please vote. We have an agenda that is now adopted. I'm pressing buttons and it doesn't work. Maybe it needs an impact adjustment. Let me be the last to wish everybody a Happy New Year. Here we go again. Time to goof up checks or whatever. If you're old school, if you're new school, God only knows what happens. That being said, number 4, approval of minutes. Do we have a motion? We have a motion by, excuse me, by Romano, support by Lucido. All in favor? No, Joe's goofing me up. I don't know why. Yeah, it's the water. It is. Number 5, public participation. Anybody in the audience wishing to address this body, please stand up and be counted. And we have a special guest this afternoon. Good afternoon.
Good afternoon. Happy New Year, honorable commissioners and chairman of the board. Thank you for giving me this opportunity. I put out a really kind of quick email, and I wanted to do this more personal. Sorry, my name is Marilyn Lane. I'm sorry about that. So I just wanted to take a quick moment just to kind of give you a quick synopsis, because I know many of you personally, and I'm supposed to have made another announcement, and this kind of takes me in a different direction, which was a surprise to me too, really as a decision. But I'm excited about the opportunity to do this. And why would I want to do something like this in lieu of some of the other options that I had been entertaining? Well, because I think 2018 is going to be a very unique year coming up, as many of us know. And Macomb has played really a vital role in election outcomes in some of the past elections. But coming from the Lansing side for the last 6 years, I can tell you Macomb has been overlooked. And maybe in part because of our fault, because we fix our own problems. Or in part, we don't quite necessarily have all the communication tools to extend when we want to work on initiatives. And how that translates to Detroit and Southeast region. And so I want to be able to play that role to help strategize. So the title that I have under our position is strategic policy. So it's strategic issues. I'll give you an example, like the no fault that just happened, and it failed miserably in Detroit, and there's a little bit of hard feelings from Detroit because we don't necessarily always hear about things and really have input as to is it a good or not. So we'd like to be able to get in front of these initiatives, talk to our partners, and see how we can better leverage the county, have better communications with the commission. I know myself and Chairman Bob, we worked on the charter, and so we have historical knowledge, and I just hope that my role, if we decide to say it anything, is a bridge to communication from the state level, from the Tri-County area to Southeast Michigan, all the way to the 9th floor. So I'm going to hope to be able to work on some of those issues on a strategic. And so I just wanted to say thank you for this opportunity and look forward to working with each and every one of you as we move forward. I will be transparent and all the communications, because I believe that's the key role that's been missing here in Macomb County kind of throughout the area. So thank you for this opportunity. As soon as I get some emails and communications, but most of you have my cell number, so don't ever hesitate to reach out. It's available anytime, and I will too be reaching out on an individual basis. So thank you and Happy New Year.
Welcome aboard. I'm sure you'll do a phenomenal job. Nice to see you. Anyone else in the audience wishing to speak? Hearing and seeing none, public participation is closed. Number 6, Greater Detroit Area Health Council. We have 1 out of 2 Lisas. Miss Lisa Mason's with us. Miss Lisa Braddock could not attend this afternoon.
Yes, on behalf of my colleague Lisa Braddock, who is in a funeral situation right now, and all of us at the Greater Detroit Area Health Council, thank you very much for making time on your busy agenda, and thank you to Bob and to Crystal for making this possible today. I want to introduce you today to the Greater Detroit Area Health Council, affectionately known as GDAC, and a grant that we're doing in Macomb County. It affects the county, so we think you should know about it. And then I want to spend most of my limited time with you talking about how you can help us further our grant activities. So I gave you a copy of the slides. The Greater Detroit Area Health Council is a nonprofit corporation that's been around since 1944. We're poised to celebrate our 75th year. And we are a regional health improvement collaborative. We bring people together to solve healthcare problems. And our vision, Healthy People, Healthy Economy, expresses that perfectly. In order to have a healthy economy, you need good jobs, and employers want to be located where there's a healthy workforce that's going to be productive. The two things are very intrinsically linked, and that's basically what GDAC is all about. Historically, we focused on bringing together those who give care, get care, and pay for health care, because it's all about health. But we've recently recognized, and the health industry is moving to move more in working with all of the social determinants of health. What makes people healthy is not just where they get health care and how it's delivered, but whether or not they have access to good jobs, to transportation, to a good education. So where you live matters, and working with other sectors besides healthcare is going to make people healthier than just focusing on the healthcare delivery system. And that's what this grant is all about. It's focused in Macomb County. I didn't get the buttons right. Where's Mike? So on the next page, you can see that it's focused in 4 specific cities of Macomb County: Roseville, East Point, Center Line, and Warren. Oh, those arrows, thank you. Okay. So it's focused on reducing chronic disease in those 4 target cities of Macomb County. It's a grant from the U.S. Centers for Disease Control through the Michigan Department of Health and Human Services. And it is a 4-year grant. We're already into the 2nd quarter of the 4th year. It will end this October. So it's not too late, but later in the process. I'm glad that we have the chance to tell you about it before it ends. Our partners in the grant, there are many. We get this done through a partnership we call Macomb Partners in Health, and it includes a number of the organizations you see listed there, and one of our key partners is the Macomb County Health Department. The grant focus is all about being healthier, and the 2 things, of course, that make you healthy are getting adequate physical activity or exercise and eating healthy. And so to summarize the whole thing, it's all about healthy behaviors like that. The activities that we've conducted over these 3.5 years that we've been in the grant, almost 3.5 years, are scattered all over the 4 cities you can see there. And I'm going to highlight just a few of them. A big part of the grant is focused on preventing diabetes. We're a great healthcare delivery system in America. If you get diabetes, we know exactly how to treat you. We've got all the bells and whistles to treat people with diabetes. But really, a better thing would be to prevent you from ever getting this really bad disease in the first place. And the CDC has a program that's tried and true and tested. 53% or 58% of the people that go through this program of pre-diabetes prevention never get diabetes. It's very effective. So we're trying to raise awareness that there is a condition called pre-diabetes. Most people think you either have it or you don't, but there's actually blood sugar levels in between not having it and having it, and that's called pre-diabetes. And if you can catch it and reverse it, you're much better off. So we want to introduce this concept to the consumer, that there is such a thing as pre-diabetes. We want it to be covered by health plans and employers to offer it. We want providers to let their patients know about it and refer their patients to it. And so far in the grant, as you can see on the top of this page, we've held 28 trained 28 coaches how to conduct this class. We've held 32 of them. They're called Diabetes Prevention Program classes, and we've educated 340 participants. And while that's a great accomplishment, it's not enough. And this is something that you'll be able to help us with. We've worked with many of the municipalities to get complete streets ordinances and walk-bike websites where residents can find out about walking clubs and get connected to other people who are walking. We have an example of a flyer in your packet that promotes the Centerline website, and there's one like it for Roseville, so it's good for residents to be aware of that. We're working with corner stores. A lot of people get their lunches or snack food at corner stores, and when you walk in, you see potato chips and soda pop. Well, we've got 2 corner stores, Sarah's Market and Warren Woods Party Shop, that now have fresh food, an alternative to the not so healthy food. We've got them refrigeration units. We've helped them with promotional and pricing and placement so that people are aware and encouraged to buy these products. We also have parking lot signs. And for those who are interested, we can give you these signs for free. They're in a cement bucket. They're ready to place in a parking lot. They say, burn calories, park here, save fuel. or another one that says, burn calories, take the stairs when possible. And for those that are interested, we have those available. We used grant funds to purchase them, and we could use help getting them placed. So I've only been able to talk about a few of the accomplishments, but I want to spend the rest of our time talking about how you can help us with this grant activity. We would like to have more of these diabetes prevention programs piloted at employer sites. We had one pilot at Fiat Chrysler's Mopar's facility in Centerline, and we'd like to do more of that, offering it on-site where it's convenient for employees to attend the classes and where employers can benefit from more productive employees who aren't sick. The cost of people with diabetes is very high. We'd like you or your employer to sponsor diabetes prevention, to cover it, to work with the health plan to cover it. You could implement healthy meeting guidelines at your place of employment. You could implement healthy vending if you have vending machines in your place of employment. And you can help us identify employers in Macomb County that would be interested in doing these things. We really need some large parking lots for this parking lot sign, and we need help reaching employers. If we approach an employer as a cold call, it's a lot less effective than if someone here were to say, I want you to hear about this great program. I think your company could benefit from it. We want you to help promote the websites that I mentioned, the Owen Jacks Recreation Center, where we've improved the equipment that's available. So there's a contact sheet in your packet of information that I passed out so you can help promote some of our grant work activities. I wanted to leave a couple minutes for questions. I hope there's some time for that. Are there questions?
Thank you very much. We need a motion to receive and file. We have a motion by Leonetti, support by Lucido. Any comments or questions? Commissioner Drollet.
Thank you, Mr. Chair, and thank you for your presentation. I appreciate it. In your presentation, you list a number of accomplishments that your organization has had. Have you been able to measure outcomes of those programs? Most of the accomplishments are a description of what you've done, but have they helped? Has diabetes rates gone down when they've been implemented? Have exercise increased? Has there been any way of measuring whether these accomplishments have actually had outcomes that have been accomplishments?
Yes, excellent question, and we do try to measure outcomes for all of our activities, and you mentioned some very good measurements. The diabetes prevention program class that I mentioned is full of measurements. How much weight was lost, what is the blood pressure, medication changes. So we'll have data from the people that complete the classes. We can look at hits on the walk bike websites that were created. We're looking at healthy meeting guidelines, how many companies implement them, and then after they're implemented, how many actually follow them. So the short answer to your question is yes, we are trying to collect that data. It's more long-term. I don't have numbers with me today, but we will definitely be looking at that. That's part of how we do our work.
Okay, thank you. Do you have an indication of what you would consider the biggest success of the organization as far as outcomes? And I don't know how long the organization's been around, but has there been something you can look back at and say, we've accomplished this?
As an organization or on this, not
as
on
an
this grant, but
organization, I
as
suppose,
GDAC.
yeah.
Yes, we have a pie chart showing the millions of dollars of impact of some of the projects we've done over the years. Yes, I could provide that.
What does millions of dollars of impact mean?
What does the impact mean? So, for example, we had a project to keep people from going to the emergency department for something that's better cared for in the primary care physician office, and we estimated the dollar impact of the emergency visits that did not occur, the more cost-effective and higher quality care that people got in their primary care physician office as a result, just as an example of one project and one way that we measured it.
Okay, thank you very much.
Yes.
Thank you. Next we have Commissioner Kleinfeld.
Thank you, Chair. It's on page 12 of our packet. I believe it's from page 1, 2, 3, 4, 5, 6. You have a map with different icons on it, and we don't have a key. I think that the little walking guy is those signs that you've placed.
Yeah, these are different kinds of activities. The classes that I mentioned, the diabetes prevention program classes, we've had some cooking demonstrations. We've had brown bag events at Walgreens stores. So yes, good point. We should probably have the legend included on this slide so you can see it's a variety of activities.
Okay, so I went through the accomplishments because this is Warren, Roseville, Centerline, and East Point. And I found programs in Warren and in Centerline and at the Recreation Authority in Roseville. While that is for both cities. I think it's very heavily used by Roseville, and unfortunately for East Point, they're not using it as much as they should. I didn't see anything in here for East Point, so I had 2 questions. On your accomplishment, you have diabetes prevention program classes. Do you have any of those that are held in East Point?
I believe there have been classes in East Point. We've held them in churches, recreation centers. We're working to get some offered through our federally qualified health centers in Centerline and Warren.
So on that map, you have the little blue teardrops. What do
Yes.
they represent?
So the map that you're referring to is a map of where these diabetes prevention program classes are held, and the map at any given time only shows classes that are coming up and available to enroll in now. So the upcoming classes, I believe, are in Warren. I believe there may have even been some in Mount Clemens. I guess I'd have to get back to you. Our partners are trying to schedule those throughout the whole county. And actually, the map is tracking classes throughout southeast Michigan with other partners, not just the Greater Detroit Area Health Council.
Okay, so then you have the monthly brown bag events at 6 Walgreens stores in target cities. Are any of those in East Point?
You know what? I don't know that off the top of my head. Any Walgreens store that was in those target cities was
Well, there's
included.
like 100 of them. So if
But
there
in
are,
those-
so
in those
I'm telling
4
you, there's more than 6 in East Point alone. So you can't
Okay.
throw a dead cat and not hit one. So all these accomplishments you've listed, if you could send over some accomplishments that have actually occurred in East Point, since they're listed as one of the target cities, and I can't find any in here.
I would be happy to do that.
Okay, thank you,
Yes.
Chair.
Thank you, Commissioner Kleinfeld. I'm shocked that they're throwing cats around in East Point. That being said, next we have Commissioner Carabelli.
Thank you, Mr. Chair, and thank you.
Yes.
Couple of quick questions so I can get my arms around this. First of all, you said partners in
Macomb
Partners
Partners
in
in
Health. There's a Warren Park and Recreation. I looked at Roseville, East Point Rec Authority, then MSU, and the others. Are they partners in as far as working with you on this project, or is that more of a financial? How are they partnering?
Most of them are partners working actively with us on this, such as the health department, attending meetings frequently. Others, like MSU Extension, was involved in specific activities like helping to train coaches for the diabetes classes. RARE, the Recreation Authority of Roseville and East Point, served as a location for the classes. Gleaners helped with some of the food cooking demonstrations that we offered. So depending on the partner, some are more actively engaged than others. The main ones, the health department, Henry Ford Macomb, and the 2 health center, federally qualified health centers, meet with us more than monthly.
Great. And the next question I have, so it looks like you've, this is part of SEMCOG, Southeast Michigan Council of Government, the map that I'm looking at. So from St. Clair all the way down to Monroe, over to Livingston, Washtenaw, and back to the water.
Oh, the map of classes that's in your packet, yes.
Right, so are they all part of this in those in those counties they're having?
So these diabetes prevention program classes that the CDC is offering are being offered by health systems, and a number of providers have been certified by the CDC to offer them. So we collaborated with everybody to make one map of Southeast Michigan, so that it wasn't just GDAX, here's just our classes in Macomb County, and here's somebody else's over in this county. It's everybody in Southeast Michigan that the CDC has approved to provide.
Okay, so then let me back up again. The Greater Detroit Area Health Council.
GDAX serves all of Southeast Michigan, but for this
portion
grant,
of Macomb County is just a portion of all the ones that are going on, and you're personally
Correct.
affiliated with this.
correct.
So you have the 4 cities that are listed on there, and then you also asked, if there's other places that, businesses and different things, but you're looking within those cities?
Yes. For
Not
those,
outside of those
for the
cities.
employers that we're trying to work with, we'd like them to at least be in Macomb County, ideally in one
Well,
of those.
no, we all want it to be in Macomb County.
Yeah,
Harrison Township, Commissioner Leonetti, he has like 3 places he wants you to go to, but he's not in one of these 4 cities.
yeah,
So-
likely though the employer has at least some employees from those 4 cities. So if the business is located in Macomb County for these things that I've listed here, we would be very happy to work with that business on these activities.
Okay. All right, thank you. Thank you, Mr. Chair.
Thank you. Commissioner Leonetti.
Thank you, Mr. Chair, and thank you, Mr. Carabelli. Commissioner Carabelli kind of almost helped me with my question. I understand the grant, that your source of funding for this comes from a grant. I guess the grant comes from the state of Michigan, is that correct?
It comes from the CDC through the state of Michigan.
Okay, and if you know, how was it determined that these 4 cities would be chosen in Macomb County?
We chose those 4 cities when we applied because those are the 4 most needy cities within Macomb County.
Okay, okay.
I can give you some statistics. on
Okay,
it.
no, and I kind of thought that they're populated or needy. I get that. No offense to the commissioners from there. The next question is, the grant runs out this October, correct? What are the prospects of this grant continuing, and what are the prospects that the grant would expand into other cities in Macomb County?
So the grant itself and the funding aren't expected to be offered again. However, a big part of this year's grant activities is focused on how do we sustain this work when the grant ends.
Okay.
So we hope that activities, and we are confident that the diabetes prevention program classes will continue.
Okay. Okay. Thank you. Thank you, Mr. Chair.
Thank you very much. Any other comments or questions? Seeing and hearing none, we have a motion to receive and file.
Thank you.
It just blew up. And Lisa, thank you very, very
Thank
much
you
for
very
coming.
much.
Very informative. Look forward to your successes in Macomb County.
Thank you, and thank you again.
Thank you. Number 7, department recommendations. Budget amendment. Great Parents, Great Start Macomb Grant, Bill Ridella. Happy New Year, Bill.
Happy New Year and good afternoon, Chair and Commissioners. The Health Department is requesting a budget amendment to the our general fund budget for the grant, to accept the grant for the Great Parents, Great Start of Macomb, resources that are helping to support our Nurse Family Partnership Program. This grant in $40,000 will help support our salaries, training, and education outreach materials within this program. We look forward to working with the Great Start, Great Parents of Macomb. We do foresee that future resources can be available from them because they get Michigan Department of Education funds, which can help support our program in any expansion that we plan. So it's an important partnership, and I ask that you approve the budget amendment proposed here.
Thank you very much, Bill. Do we have a motion and support to forward this to finance? We have a motion by Brown, support by Myjack. Any other comments or questions? Commissioner Drollet.
Yeah, thank you, and I apologize if this is somehow clear in the documentation, but is this a grant that we're receiving to provide these services, or are we increasing the budget? Where are the funds coming from, I guess I should ask?
Okay, we have general funds that support this program. These will help. The $40,000 are going to go into the funding of this program to do the training that we need to do for the program.
Right, but where is it coming from?
The $40,000 is
yeah.
coming from Great Start, Great Parents of Macomb. They get dollars from the Michigan Department of Education.
Okay,
they're
so
part of the Macomb
So it's
Intermediate
state funding
Service.
that we're receiving that we're applying toward this particular program.
Correct.
Thank you, Bill. Appreciate that. Thank you.
Thank you. Chairman Smith.
Thank you, Mr. Chair. Hi, Bill. How are you?
Good. Thank you.
I just have a question. Are we targeting any specific groups with this? I know I've read something in the Detroit News, I don't know how long it was ago, about how Michigan is the infant mortality rate for Hispanics and African American children is like ridiculously high. So when we get into a program like this, it seems like it might tie in. Do we target specific groups like that to try to, kind of change that trend?
Yes. Thank you for that question. This program, in fact, Nurse Family Partnership, targets first-time moms, low income, and our office is in the Thompson Center at 9 Mile and Van Dyke. So we are focusing on African American women through this program because that's where a significant number are located in Macomb County. We would love to expand this program into Mount Clemens and even in other parts of the county. But again, getting our feet wet with this program is, this is our first year. So that's where we're doing the program. Low income, Medicaid primarily are the targeted population too.
Okay, thank you. Thanks, Bill.
Any other comments or questions? We have a motion and support. Please vote. Thank you, Bill.
Thank you, thank you.
I think this passed. 12-0. Next, 7B, lease agreement, Van Dyke Public Schools, Max Thompson, Family Resource Center classroom space. Mr. Cutler, Happy New Year. Boy, you're going to be here for a while, aren't you?
Yep, next 4 items are mine.
Yes,
Happy
sir.
New Year. I'm happy to answer your questions, but the Max Thompson Center, MSUE, Macomb Community Action, and the Health Department all have offices at the Max Thompson Center, which, as Bill just mentioned, is in South Warren. And there we have a lease with the Van Dyke School District. This lease has been in place for a number of years, and now they have increased their lease rate, and this increase in the new contract is coming before you today.
All right, thank you very much. Do we have a motion and support to forward this to Finance? We have a motion by Sauger, support by Carabelli. On the board, we have Commissioner Kleinfeld.
Thank you, Chair. You said that the last lease was a several-year lease?
Yes, it was. It had language in it. It was originally agreed upon between the former superintendent of Van Dyke School Districts and former Health and Community Services Director Steve Gold. And when I went back and reviewed the lease, there was an automatic ability to increase their rent based upon their cost. They provided us with costs, and the cost over the 3 years that they had provided to us, they had a loss of $97,000 during that time frame. Now, not all of these, so it's a large building, and not all of the building was being used and leased from them at the time. But so this is their current lease is based upon their costs, actual costs, plus $10,000 for repair and maintenance. And as I'm the fiscal person running the program over at the Macomb FRC, Family Resource Center here, and Mount Clemens, I would be ecstatic if I could get away with $40,000 annually for repair and maintenance. These old school buildings are very expensive. Yeah. So in my opinion, that they're still going to lose money on this lease.
Okay, I do have a number of questions relative to that, but I want to go through systematically with the pages. So on the first page, which is the recommendation, it says, let me go on this second. The termination clause says this agreement may be terminated by either party for cause or Macomb County for funding issues. What would be the cause? Usually we have an opt-out if we choose to opt out, as long as we're given a 90-day. What's the definition of cause in this situation? It just says for cause.
I cannot give you an answer to that. Corporation Counsel Risk Management reviewed this contract that came over from Van Dyke School District. As far as the 90 days for funding, that obviously a large amount of this is based upon our
I'm okay with the funding. I was concerned about the cause, because almost all of these leases we have an opt-out as long as we're giving notice, and this opt-out says for cause, and most of them don't. So I'm just curious as to why it says that, and does our definition of cause equal the Van Dyke School District's definition of cause? So I was a little bit concerned about that. This indicates one of the reasons it's going up is because it is below market value and based on the operating costs. I'm really curious as to where you get the market value on a closed school, because I can tell you we closed 4 elementary schools in East Point, and the school district was selling them for $90,000 apiece. And so there is no market per se to rent one. A church isn't paying for, in the middle of these neighborhoods, there is no market value that for anybody to be paying. I'm not saying what you're doing is right or wrong. I'm simply saying there is no market out there in the neighborhoods with these schools where people are paying that kind of money.
And I do agree that there's a limited number of people that would be interested in leasing or renting school district space. However, we have, because of the Head Start program having space in classrooms, we have had, historically, the planning department came up with a rental value for those spaces. However, the Head Start program found fault with our appraisers. Again, as the fiscal person, I did not want to pay for an appraiser, so we used the planning department to do that. But they had found a finding of that, so we had went out and hired a independent appraiser to appraise property. And so we have gotten outside sources from different appraisers on school property. So certified independent appraisers have come back with values of school district property.
Okay, and so the original contract, I would like to see a copy of that before we vote on full board. This contract goes from 9/1/2017 to 8/31/2022. Is the amount we're paying monthly then locked in for that 5-year period?
Yes, it is. This does not give them that accelerator or bringing it up to bringing up cost.
Okay, and then I'm very bothered by the cost change, because school districts know exactly what they pay in a building. They know how much it costs to clean a building. They know everything about one of their buildings because they're a governmental entity and they have to. So in 14-15, the lease was $12,600 basically. In 15-16, it was $28,000. In 16-17, it was $32,000. Now it's jumped up to $69,000, which is the increases year after year after year. At least the first one is more than 100% increase, and then it jumps up, and then and this one is more than 100% increase. And I'm a little bothered by that for a couple of reasons. I don't understand why the custodial went from 0 to $13,751 to $26,270. How does the custodial jump up from 13 to 26 in 1 year in the same building?
Well, when it was originally leased and originally built out for our usage, a limited amount of the space was being used. I would assume, again, from my experience at the Macomb FRC, we originally came on with 1 janitorial staff employee going through the Mount Clemens schools. Now we have 2. Again, as the services go up and the number of people using the area, the janitorial work would increase.
Except that the heating doesn't do that, and the electricity doesn't do that, and the water doesn't do that. So I find, I'd like to see that old contract, because I'm not happy that this thing has gone from $12,000 to $70,000 in a span of 3 years, and I'm having a hard time with it. So I need to see that old contract. I'll move it on to finance, but I'm going to have to think about this one. Thank you, Chair.
Thank you. Next we have Commissioner Carabelli.
Thank you, Mr. Chair. Gary, we had the opportunity to talk prior to the meeting, and I thank you for that. And to the board chair, you know, I know back a while ago we had the opportunity to do some video messaging over at the high school. And I'll be real honest with you. The last presenter here, Lisa, with the prevention for the diabetes, pre-diabetes, And all this stuff can be taped. You know, we have this technology here, and we have services that are only being provided in certain areas of our county. And I think every commissioner that's sitting here, one of the cities, or most of them, have a cable TV program. And there's no reason why these things can't be taped and can't be aired on the local station, because there's some boring stuff on the station and they put NASA on there when they have nothing else to put on mine. So at the end of the day, and Bill, I'm glad you're here too, I really think that, you know, all the services that you're providing at this school, all the services that you provide throughout your department, and Lisa, this grant that just came up, and the services and the educational programs that we're doing, it's going into a micro, and it's in those communities. And poor Commissioner Leonetti doesn't have anything coming out to his community. And I'd like to at least have it on video so that it can be shared in the other communities. It's more of an informational thing that and I know this isn't totally germane to the subject, but I'm sorry, it just, we really need to get this word out, and I don't think it's that hard to kind of get everybody together and do that. And you had mentioned that your people would be ecstatic to have the opportunity to pass the word along.
Certainly.
Thank you, Mr. Chair.
Commissioner Carabelli, we've gone bananas as far as the Max Thompson Center. I think they're doing a tremendous job. They keep growing. I have a feeling that a lot of the questions that Commissioner Kleinfeld had will be addressed by the amount of usage of the building, because I don't think they were using the whole building when they opened up, whenever it was. I think in 2011, if I'm not mistaken. But it's a tremendous asset to the neighborhood, and it's being used by people in that area extensively. I'm very happy that it's there. I hope the services that are provided there continue. But I think we've had the Max Thompson Center on Warren TV anyway, a couple of times. I don't know if it had any effect on it or not. Any other comments or questions? Commissioner Drollet.
Thank you, Mr. Chair. Just to follow up on a couple of questions asked by a previous commissioner, how was the cost for this particular contract derived? Was it something that was it a proposal they sent to us, and then we review, and now we have it before us, or is it a negotiation? They proposed a dollar amount, we came back with a lower amount?
So the original contract had again, I wasn't involved in any of that stuff, so it was between Steve Gold and former superintendent at Van Dyke School Districts. They had came up with a rate of, I believe it was $1.06 per square foot, plus a rate for the janitor originally for the usage. And
that was 2000 and what again?
The year of that lease, I believe it was 13, 14, but it 13?
Okay, close enough. Go ahead, continue, I'm sorry.
So the lease was set up, and the lease had, and again, when I got a copy and read the lease, it had a paragraph in it that said that they had the ability to increase the cost to us based upon their actual costs, and that's what they provided us, was this actual cost log of their expenses with a $10,000 allowance for repairs and maintenance. So that's how they've established their cost and the showing of their loss.
So they're acting upon the language of the original lease, which allowed them to increase rates based on demonstrable costs, and so that's what they're doing. It doesn't provide, this is not the end of a lease, so to speak. This is a amendment to the lease that was provided for.
Or a replacement for the original lease. Because this one has a different time frame,
okay,
and a specific time frame spelled out with no adjustment amounts in there. So they're asking for a specific dollar amount monthly for a specific period of time.
Okay. And when does the current lease end if we didn't extend it?
I'll make sure you guys are provided with a complete copy of the original lease. I can look it up here if you'd like.
Well, I'm curious if if the original lease ends and this is substantially kind of more or less a new lease more than it is a adjustment of an existing lease, you know, then of course we can have more, we have more ability to influence the terms. And you know, again, I'm just following up on Commissioner Kleinfeld's thoughts. Is it something that we can, you know, come back and say, well, thank you for your recommendation. We propose the following, and ask for a lower amount, if indeed she's correct that these schools can be purchased for next to nothing.
I can talk, again, right now the dealings are being done between the Health and Community Services Director, Rhonda Powell, and the current superintendent of the Van Dyke School District. And I know that, again, both of those positions changed mid or late last year.
Okay. Okay. I just wanted to get those thoughts out there, and hopefully when it gets to full board, or finance rather, we can have another look at that. Thank you.
Thank you very much. Commissioner Smith.
Thank you. Hi, Gary, I guess just to follow up on this and Commissioner Kleinfeld's comments, I mean, have we ever, that you know of, have we looked into possibly purchasing the building as opposed to spending $69,000 a year renting a potential $100,000 building? I mean, is that something that has been discussed ever that you know of, or is that, I mean, I'm not sure the price of that building, don't get me wrong.
Right, again, so the billing that they're giving us is their utilities plus $10,000, and so if we bought the building, we would still have all of those utility costs. So effectively, what you're talking about would be a $10,000 cost that they're calling allowance for repairs, and again, it is.
So you're saying the utilities have gone up by that much?
Well, no, the utility.
You said, that's what you just said,
Yes,
utilities plus 10,000.
The utilities from the original amount, the utilities from the original amount, I believe it's, I don't have your full the packet you have in front of you.
Because it looks like the only thing that went up considerably was custodial, and I guess I would,
But
obviously we would pay
so what
that,
I'm
but-
saying is that the utility costs there are pretty consistent across the board. The issue was the amount of rent that we were paying. Whether we were using the rooms or not, they had to heat the whole building to keep it from freezing, et cetera. So the utility costs would remain fairly flat. I mean, obviously, if we're in a room, we're going to use more heating, more electric than if we're not using the room, but those bills would be
Okay,
relatively maintained.
so then I'm confused. If the utility costs kind of stayed the same, what was the big increase, just custodial? I mean, is that the reason for the,
No, the reason, their costs have remained relatively the same. The real issue is the amount that they were charging us for rent was so low. As we filled the space, the rent was not enough to cover their costs.
Yeah.
Because we grew.
yeah, but the utilities stayed the same. So it's not, I mean, it wasn't costing them more money except for custodial. So I mean, I don't know, I'm confused, and obviously having been a part of all this, you got to understand from our viewpoint, we kind of look at this as a, you know, in a peripheral, that looks like their utility costs have stayed the same, whether we've had one classroom filled or all the classrooms filled. The only thing that looks like it went up on that, and understandably so, would be custodial costs. But somehow or another, cost of operating the building has gone up in beyond that, even though the utility costs have stayed pretty much equal. So I guess I'm just missing the big increase, you know, in the rent for, I mean, they see they can get it. I mean, it seems, at least it seems on this side, it seems mostly because they think they can get us, and they kind of got us locked in right now. And that's just my perception of this so far.
So again, I don't know if you have the schedule that I have in front of me.
We have a
but
couple different schedules.
I have heating costs going across from 14-15 of 14,665.
Yep, it actually lowered in 3 years.
Right, so,
Right.
but as you can see, those costs, the cost of running the building, and again, a lot of the cost increase was driven by the custodial price, but below it, you see the amount that they were collecting for rent, and the loss to the school district of $30,000, $25,000, and $37,000. So the school district is losing a $93,000 over those 3 years.
Okay, I see what you're talking about now. All right, you know what, I'd like to look into it a little more and actually have you talk with Ms. Kleinfeld on some of her questions. But it does seem like on something like this that, you know, it should be at least something that we've considered, since we're utilizing the entire building, that maybe at some point it's worth buying rather than leasing.
Wow.
So, just a thought. I mean, and
Yep.
sometimes
Nope.
it's better to lease than buy. So, I mean, you guys have looked into this, but I was just wondering if you knew about it. You don't seem to know if we've looked into that prospect at all.
No, I haven't heard of any conversation going on about purchasing of that building.
Okay, thank you.
Thank you. We have Commissioner Brown, Kleinfeld, and Ridella on tap. Frankly, Gary, after looking at this, I think that they cut their own throats to get us in there to begin with.
Yeah,
And
again,
now they're trying to salvage the situation. But I think going through this with everybody and explaining it, so on and so forth, will actually do everybody some good. Commissioner Brown.
Thank you, Mr. Chairman. That building and the service do provide a public benefit, so there is some, you know, there's some value being done there. If we have to pay a premium for some of the space, maybe it's okay, but I also don't want to be taken advantage of and be subsidizing something that's maybe, you know, maybe it's got other issues going on. You know, they could probably sell that, tear that building down, have vacant property, and do more with that property than the building itself's worth. So that's where the value is. But I mean, I've got, you know, I get every confidence in Gary in that, you know, they're, you know, they've taken a good look at it, but I share some of the concerns and about subsidizing it, you know, maybe more than need be. Maybe it doesn't need that. Maybe that dollar amount can come down a bit, but thank you.
Thank you very much. Commissioner Kleinfeld, second round.
Yes, thank you. A couple of things. First of all, I agree that it's a huge asset to the neighborhood in the area. I'm down in that area, and I know what's happening with all these closed schools, and most of the entities are taking a loss on the schools. We've got a closed senior center we rent for $1 a year, and the reason we rent it for $1 a year is the use of the building. When a building's not being used, it deteriorates rapidly. So the idea of covering the cost, I don't know of any closed school in our area, even with the churches paying and everything, that they're actually covering the cost. So we do have a negotiating standpoint on it. A couple of things. This contract is dated 9/1/2017. Are we already paying the higher amount?
no, we have not paid the higher amount.
Okay. We are paying for the renovation, so we are also paying for the increase in the value of this building. So I would love to rent out a building where my renters, if they want to double the size of the building, they pay to double it and I get to continue to own it. That's a pretty sweet deal. So I think we could negotiate, and what I'm hearing is Van Dyke says we want this much because it costs this much, and we say yes. Guess what? If there's nobody in there, they still have to plow those sidewalks. They still have to maintain that building. They are, and the building falls apart much quicker. So this is a huge benefit to them. My last question is with regard to custodial. Did they have did they contract out custodial work in 15 and 16, or did they use Van Dyke employees, and are they using Van Dyke employees in 16, 17, and today, or are they contracting out?
I do not know. I know that they're providing the custodial service, whether it's through a contract or their own employees.
Okay, because I would really love to know if the custodial changed between 15 and 16 and 16 and 17. So if you could get that to us before full board, that would be great as well. Thank you, Chair.
All right, thank you. Last on the list, we have Commissioner Sauger.
Yeah, just think, where do you go if you say no to all this? I've driven around a lot of them schools down there, and they need a lot of help just to get built back up again. So if we say no to all of this, you better come down. Where the hell do you go? Nothing else is better. So think of it real seriously when you start negotiation and try to cut $1 or $2 here. It's helping out that community. That place is kind of like a booming shopping center at times. and it's good for the district. But if you say no to this, if you say, I got to have more from you, where are we going to go? Think about it. Thank you.
Thank you, Commissioner Sauger. Good point. That facility is being used constantly, as far as I know. That being said, any other comments or questions? Seeing and hearing none, we have a motion and support. Please vote. You've aged a couple of years, Gary.
Yeah. Getting closer to retirement.
There you go, passed.
Would the board like me to extend an invitation to the Van Dyke School District Superintendent to the finance meeting?
That might not be a bad idea.
I will get that to Crystal. I'll forward. I have it here in my emails. I'll forward it to Crystal, hopefully before you guys are out of here today.
Fair enough. All right, Gary. 7C, Budget Amendment, Macomb Community Action, Office of Senior Services. You're just full of happiness today, aren't you?
Okay. So what I'm looking for here is just a basic change within the budget line items, moving something from contract services into part-time payroll and fringe benefits. What we have historically done with our resource advocates is we have contracted with the staff, with people to provide these services. So they are contractors, they're not county employees. They receive 1099s, not W-2s for payment. There is a specific IRS document that we look at to decide if somebody is a contractor or an employee. As our services menus have changed, et cetera, we're getting closer to the line of them being employees. For example, we have Medi-D enrollment, and we're saying that we're going to have people at this location at this time. So we're having these contractors be at a specific location at a specific time. Once we start assigning locations and times, they start to become like employees. So we're just wanted to conversations. We regularly have conversations with HR and finance about individuals that we have contracts with to make sure that they fall within the contract rules. These are approaching the area. They're using county equipment.
Right.
There's space in our offices that we provide to them to where they pick up their mail, but they also sit there, and so we're approaching the line where they are acting as employees. Overall, I don't have any expectation of this having any net cost to us. It could even possibly be a net decrease because in the contracted amount, we pay them a contracted rate per unit as opposed to them working on an hourly basis. And the rate, again, HR is working with our people, but without your approval, we're not going into the process of creating positions and filling those positions. But I have the expectations that the net cost should remain the same.
Thank you. We need a motion and support. We have a motion by Drollet, support by Kraft. We have a number of people on the list here. Boy, you're stuck between a rock and a hard spot. Because I know how that 1099 business goes, and the IRS has no sense of humor. That being said, Commissioner Chairman Smith.
Thank you, Gary. I agree with everything. We talked about this before. The only concern that I have is that we also, right before for the budget, we didn't allow any new positions because of that policy or the study that's out. And I know it's in the hands of our HR. And I'd like to kind of, personally stay consistent with what we just did with the budget. There was a lot of other positions that we didn't approve that were grant positions and, millage positions. And although I do understand this makes sense, I'd like to make sure that it doesn't have any, that study doesn't have any effect on this position, so to speak. And I've asked Ms. Bethanti a couple times to look into those positions that were requested and see if she can tell us, you know, if this study has any effect on them or if vice versa. And I'd like to do the same with you and just ask if you can get something from her or get her to at least tell us that that granting this position doesn't then mess with, you know, the results of the study that we might be.
Yes, and again, we're looking to, I certainly understand, we're looking to establish the budget move to the, from contract services to payroll, and HR and the program staff back at Macomb Community Action will figure out exactly what positions and pay ranges make sense. But again, before any of this, before any position could be posted or anything else, we would need the budget to be switched over to staffing and number of positions created. And I would assume that that would all come back whenever we're going to bring the other positions that Macomb Community Action requested and had funded in this budget before you to fill those positions.
Okay. Well, I'm going to try to contact Ms. Bethanti and talk to her a little bit about this position again, and I mean, not again, but and again talk to her about some of the other positions, so we can at least, you know, make sure there's no, you know, effect on that.
And our program people met with HR on Friday because I got an email over the weekend from the division director with a follow-up on this program, wanting to know if I needed any of this information for you, knowing that I was coming in front of you today. So I know that they're working very closely with HR on this transition.
Okay, and that being said, if she gives the general okay that there's no effect on it, I see your point and I agree. I've seen this happen before where we could get in a lot of trouble, so to speak, by not calling it what it is, you know, a real worker for the county as opposed to a contract worker. So thanks.
Thank you. Next we have Commissioner Drollet.
Thank you, Mr. Chair, and thank you for that explanation. I appreciate it. And I recognize that you said that the costs are going to be the same, potentially less. Do you have any idea if it might have impact our longer term, like legacy costs, whether that's health care for retirees and that sort of thing?
So these would be part-time employees.
Okay.
So there would be no legacy costs at all involved with them, either under pension or retiree health care.
Thank you very much.
Commissioner Leonetti.
Thank you, Mr. Chair. This isn't really your fault, but one of the things we had last year for some of us new commissioners was we'd see these, you know, these contract services on every department's budget. And it just says contract services. It doesn't have any line item underneath that. So I know we've put together a proposal so that we can potentially get an idea of what the line items are. I think it would be, I echo a lot what Chairman Smith says, that you know, we had to make some tough decisions here and not offer any new positions. And now I understand it was in contract services, but now it looks like we're going to shift it into the budget, and it almost creates like a position. And so I hope, you know, I guess this isn't really to you. It's more just to the board and what we're going to do about trying to find out more of these line items on contract services. It would be a lot easier for me to support what he's doing if I had seen over the year that, yeah, he had all these contract employees, and now the IRS is coming along and saying, hey, you can't do it this way. It would be a lot easier for me to support that position. Otherwise, I have to be careful that somebody isn't padding contract services and then coming back and saying, hey, guess what, I need a new position here. So it's just something that I hope we don't have a problem with going forward, or we try to change going towards the future. Thank you. Go ahead.
I just want to make you, the IRS has not contacted us or done anything. We're trying to avoid that from happening, but I don't want anyone to read that the IRS has already found an issue with this, because that has not happened.
Thank you.
Not yet.
Yeah, well, and I get that. Prevention is always good. No, thank you. Thank you very much. Thank you, Mr. Chair.
Thank you. Commissioner Carabelli.
Thank you, Mr. Chair. I don't think you're going to have any IRS problems. I don't think that's going to be a problem at all. It happens in private business and it happens in government all the time. That's just my 2 cents. But unfortunately, I will not be able to support this, even to move it on to finance, because as a board, as one commissioner, I took a very hard stance with all the department heads and said I'm not willing to hire the 14 new people that all the different department heads came up with. I said I'm not willing to have any pay raises or job changes, descriptions to anybody in the entire county until Mrs. Bethanti comes back with this study. Because too many times we put the cart before the horse, and that horse is mad because he can't go nowhere. Well, guess what? It ain't happening, at least on my vote. I can't even support to move this forward. I have no problem if we want to table this until she comes up with the process and how she's going to roll this out, and she blesses this position, that it falls in with the job descriptions, that we spent a lot of money from somebody on the outside to do it. And I couldn't, rightfully so, look at planning, look at the prosecutor, look at the sheriffs, look at all these departments. I said, hey, love you, but I'm standing fast, I'm not doing this. And I can't come back 30 days later and do it again. So one commissioner won't be able to move this on until she makes that presentation and she tells us where all this falls, dollars and cents, of where we're gonna be. That's just one commissioner. Thank you, Mr. Chair.
And I certainly understand that, and that has been some of my hesitation in moving this forward, also in trying to establish a pay range for these positions with, as an employee, not knowing where, if let's say for sake of argument that it's determined that $22 an hour is the right rate, we put it into a classification, and then the study comes back and says there's a 10% increase to that and it should be $25 an hour, then maybe they should have been in a different position that would have adjusted to the 10% less. Right, but they should, the proper compensation is of course important with this, and I understand and respect your position.
Thank you, Commissioner Carabelli. Last on the list, Commissioner Kleinfeld.
Thank you. I'm throwing dead cats. He's making horses mad today, so we're in rare form. Okay.
Well, animals are flying everywhere in Macomb County today.
$220,000 in salaries to be transitioned to part-time staff. So there would be no possibility of creating any full-time positions.
Right now, the people that are doing it are on a part-time basis. We are not looking to create part-time.
But if we make this change, there'd be no possibility of you changing them to full-time positions.
It is. It seems like it is. I will tell you, it would not be my intention ever to change these positions to part-time position, from part-time to full-time.
But once we put that money into salaries,
they'd be going into the part-time position. The 70203 is budget for part-time positions. And again,
But you can move that. You can move that within your category.
Yes, I have no intention of. Again.
Okay.
I will say this, is that generally speaking, I can employ 2 part-time positions for the same cost as 1 full-time position because of the cost of benefits for our full-time positions.
Okay, would there be any union issues there?
Currently, there is no union that represents these people because they're contract employees.
Do they work with union full-time employees?
There are employees within the Office of Senior Services that are unionized. There is no like position within the union. The duties they do are completely different than what other people do. A little bit of case management's done by case managers within Macomb Community Action that deal with more of the homeless type population, where these people are targeted specific for senior citizens. Okay,
this is not a new grant. You're just changing the allotment. This grant was voted on in 10/25/2017. Did we vote on this grant, do you know, back last year?
So this isn't really a grant. We have a grant called Resource Advocacy, but our resource advocates not only work within resource advocacy, but our resource advocates are the people that go out and do initial assessments for home delivered meals and the semi-annual assessment. So these people, piecemeal or piece bill the program. So if they work for a Med-ED application, and I don't know the rate off the top of my head, but let's just say it's a $22 payment thing, that would get charged to Resource Advocacy, and they do an application, an initial home delivered meals application for someone else, that's a $36 charge, and that would go to the home delivered meals. So this classification or group of people, costs are across a lot of different senior services organization programs.
The origin of the funding is?
AAA 1B is who the money comes from that supports the bulk of this.
Okay, and we know that they changed their funding source. They're going through stuff all the time. If we make them our employees, and even if they're part-time employees, if the funding is cut for this particular thing because they change where they're dishing it out on a regular basis, do we maintain those employees? So like, I got a little confused because there's back-to-back sheets, recommendation sheets, and then there's the United Way contract. So I'm assuming the United Way contract is for the next agenda item.
It is.
Okay, so I take back the 1025. So if we make them part-time employees of the county rather than contract services, and they change their funding, do those positions continue to exist?
Well, if I don't, first of all, again, I had this conversation with my leadership team this morning about sustainability of our programs at Macomb Community Action. But again, if I do not have funding for these positions, then I am not going to continue to have these positions. We cannot provide services without funding.
Okay, we're reallocating the money. Once we reallot the money, you have the funding. Do you understand what I'm saying? So even if the funding, even if the revenues get cut, once we vote on this budget amendment, we have put that funding into your salary area. So I just want you to just be honest with me. So if those revenues went away, that's no longer associated with this. This is now right. It's in your budget. Those positions would stay.
First of all, while they would be in the budget and the positions could stay, as a fiscal steward of the county's money and Macomb Community Action's money, it is, we do not have the wherewithal to spend money without some source of funding coming in to cover that. I have a small fund balance, which I am budgeting to be spent out over the next 3 years. I could not continue in good faith to maintain positions without funding. That being said, if the federal government were to shut down next Friday, which again is on the threat, and there is some funding delay, I am not expecting that operations would shut down immediately upon a federal shutdown.
Okay, I think what my thought process is once we put those in your salary, we're providing the funding. Even though we have a revenue source, if that revenue source goes away, we're technically providing the funding. And I've asked some really straightforward questions like, would you create full-time positions with this? And the hesitation concerns me. Like every direct question that I get a well in a lot of things, but I'm concerned. We've taken a tough stance and we've turned a lot of people down, and I know you need this. I don't want you to think that I don't think you're trying to do the right thing. I do think you're trying to do the right thing. I think we have a lot of administrators that are also trying to do the same right thing, and that's something that we have to work out. But once we put the money in your salaries, technically the county is providing the funding in your budget. That's a yes or no.
I would disagree.
Okay.
The county gives me a very small portion of Macomb Community Action's budget. Most of my money is federal and then state.
Right, but I'm going to let other people talk. Right. But what I asked is if the revenue source dies down, do the positions go away? And you couldn't answer that question, which is an indication to me that we are making that commitment.
Well, again,
Okay. I'm going to let other
positions
people.
don't necessarily go away, but I would
Okay.
not fill them, or I would have to lay people off if I don't have funding for that.
Okay, I have to
understand
let other people speak. Thank you.
All right, thank you. Next on the agenda, Commissioner Sauger.
Yeah, when are we gonna invite Karen up here instead of holding the employees hostage for raises or benefits or whatnot? Get Karen up here so we can ask these questions and get it settled. When is that happening?
I don't have a word on that as of right now.
Well, let's do it, because this one's got a question to her, this one's got a question. Let's bring her up here so we can ask her and get it settled. One commissioner says we shouldn't give any raises, any benefits. Fine, but what's the reason? We have to hear it from her, what she wants. Get her up here.
Do the best you can.
Well, if you'd like me to
Commissioner
go on to
Smith.
that, they've not made the results of that study public yet, Marv, and they haven't made it, they haven't made it public to us, and they haven't given us a date when they're going to make it public. Now, I don't know who else knows the results of it, but part of what I think a few of us are at least talking about is waiting to hear the results of that study, and I have mentioned it to her a few times that, if nothing else, even if she could give us partial results that affected some of the requests that we've looked at, that would even be beneficial. But they haven't released the results yet, Mar. I don't think that all of it's done. That's at least what I've heard. So, and we will ask her, I will be contacting her again after this to talk more about this again. But thanks.
All right, let's segue into Chairman Smith. That was smooth.
So, two things. One, I'd like to echo Commissioner Carabelli's thought. I would be moving this forward, but I wouldn't be voting yes on it until we actually, unless we could hear from her that it had no effect on, for the same reasons that we didn't vote for any positions before this. Secondly, Commissioner Kleinfeld, I think that most of these contracts, most of these positions now that are hired under grant funding, if I recall, are hired at least in a very clear statement that says this position is funded by grant money. If this grant money runs away, this position will, no longer exist. I'm pretty sure I talked to Karen about that's in there. And then also that if you lost grant funding for that, you would need to at least request more money from the general fund to keep those positions going. So therefore, you would have to come to us to actually ask for that amendment to turn those grant-funded positions into general fund-funded positions, as far as I get the grasp of all that. So that was just more of an explanation. I think that would probably at least, I know they haven't always done it that way, but a lot of times they've, not they, I don't mean you, but I mean contract or positions that were grant funded, where the grant went away, they would, the department would almost inevitably come to us, and we would almost always agree to fund it by general fund, but that's the way that it works. And if that's my idea, just to give you a little bit of
Point of order, he specifically said this isn't grant money, and that's where that line of questioning went down. The next item is
grant money, correct? This is grant funded.
Oh, you said it wasn't a grant.
Makes a difference. This is grant money, correct? That covers the contract workers at this point.
The contract workers work across a number of different programs.
Grants.
There is a grant specifically called resource advocacy, but these people, even though they work in resource advocacy, 100% of their pay does not come from that. It comes from other grants, including Meals on Wheels and other senior services grants.
But at the end of the day, if a significant portion or any portion really were to go away of these grants, you would need to find a way, if you were going to try to keep them, to refund that, and you would have, I don't mean refund it, but fund it from a different source, which would mean finding other grant or coming to us.
Just like I would have to do with the clerical staff, the supervisors, and everyone else in that department.
Okay, thanks. I just wanted to, I thought we might have been on the wrong page here.
All right, thank you. Commissioner Kleinfeld? Last we have Commissioner Drolet.
Thank you, Mr. Chair. if with the, I think I was the one who made the motion. I wonder if that motion might be able to be amended, that we forward this to finance and then table it till we have the opportunity to receive and review the report that we expect on personnel decisions and so forth.
A motion to table kills all discussion and takes precedence. We might be able to do it then, but adding a tabling motion, to this now would, I think, would be out of order and kill the whole thing.
So the way it's currently provided, it can be moved to finance, and then at that point, there's no need to take it up at the immediate finance committee meeting. It can be taken up at a future finance committee
It's
meeting.
a motion to forward to finance.
Okay.
What we do in finance is completely separate of what happens here.
And, what's that? Okay.
Yes.
And Bobby, you looked like you look about to say something there.
I just wanted to make a quick point that these are already positions that are in place, and it's not an emergency immediate move that, so if we did nothing on this or voted it down based on something when it came down to it, say we didn't get the answers we want, you're still able to continue on with this work and just, you're just looking at an IRS issue that you're trying to avoid, so these people would still be in place.
A possible IRS.
Well,
issue.
no, that's what I'm saying.
It would not change,
not
it would
gonna
not
change
change our
anything
operations
in the
as
short
far
term.
as far as the people currently doing the work. They don't know that I'm here in front of you. They don't really, I believe there's been some conversation about them having to reapply for jobs if they become part-time.
So,
It's an application process.
I'd
that they're
recommend we
not
just
on it.
move forward with whatever you're gonna vote on this, and then if at the time we still have not heard from Karen Bethanti, vote how you wish on this item, and then it's not going to keep,
Yeah.
anything.
Oh, okay, I appreciate that.
Commissioner, I don't think this is the committee to hold on to this and keep it hostage.
No, that's fine.
And then
Then
move it
I'm willing to
to-
just move
finance
forward
is
with it, and move it to
probably
finance.
a
and
little
that-
better.
That's perfectly fine. I just wanted to, thank the director for being proactive and understanding that we potentially are running into something with the IRS and the stewardship of looking proactively. So I don't want him to think that this reflects, our concerns and questions reflect in any way on that judgment. It's just we have a broader perspective of the entire county, how we're moving forward with all these decisions. So I want to make sure that you understand that I think the board appreciates what you're doing and appreciates your proactivity. Thank you.
Thank you.
Thank you. Seeing and hearing no other discussion, we have a motion and support. Please vote. Motion passes 7-6. Moves it to finance for more cheap thrills. 7D as in David, budget amendment, Macomb Community Action, United Way grant. The floor is yours, Gary.
So in the United Way grant, we received a grant last fiscal year, and we identified that with systems integration. So in the second year of the grant, when the budget was proposed and brought forward, so the current fiscal year that we are in, I put in the budget an additional $100,000 and put that all under contract services for the continuing work on getting the systems integrated. And what I mean by that is that within our areas at Macomb Community Action, our clients are kept on a different group of databases. For example, the Office of Senior Services has their own database. The Head Start program has their own database, and Community Services had their own database. So we were trying to, instead of counting each person or family that was using it in 3 different systems, to try to integrate it so that we knew the services that we were providing to people. So in the second year of funding, we are not spending the $100,000 on contract services. And what we had sent and submitted and finally got approved from the United Way included some expenditures that are outside of contract services. So because of the line item requirement that if I move more than $35,000 in the line item that comes before you. That's what we're doing here. So this is a grant that we have received. The amount hasn't changed. It was in the budget that was presented to you. All we're doing is moving money out of contract services into other areas.
Thank you. Do we have a motion and support prior to discussion? We have a motion by Kraft, support by Toko. Discussion. Nobody. All in favor?
Please vote.
Please vote. Oh my God.
Made it through that one.
Romano, what did you do?
Break it again?
Motion passes. Motion passes 12-0. 7E, Budget Amendment, Macomb Community Action, Emergency Solutions Grant Program.
Thank you. So what happened here is when I built the budget for this fiscal year, I had built it for $50,000. When the plan that was approved by the Board of Commissioners came out, and additional funds came to Macomb Community Action to provide what we call rapid rehousing for people that are already homeless and prevention. So between those two, we had additional funds that were on top of the money that was already budgeted in the budget that you guys approved. So this is just additional funds that we are spending instead of other community partners spending under this grant.
Do we have a motion? We have a motion by Carabelli. Do we have support? Support by Lucido. Any discussion? Commissioner Carabelli.
Thank you, Mr. Chairman. Real quick, is this, what's the total amount that this is being added to?
The total dollar amount, I believe it's 93,000 from 50,000.
So it'll bring it up to 93,000?
Yes.
Okay, all right, thank you, Mr. Chair.
Thank you. Any other comments or questions? Seeing and hearing none, please vote. Motion passes, I believe. 13-0. Gary, thank you very much.
Thank you.
Yes. We'll have to make a budget amendment to buy Gary a drink. Number 8, correspondence. Area Agency on Aging update. That's in your packet. We have a motion to move in their entirety. That's right. We have a motion by Drollet, support by Kraft. All in favor, please vote. Yes. Yes. We're not counting abstentions today. Number 9, new business. Any new business from commissioners? Commissioner Sauger.
Yeah, why don't we get a hotline in the county, the Karen Springer hotline? That'll take all the questions people have asking us in public, what the hell's going on with her? Just have them call that number. Thank you.
1-800-00. Commissioner Smith.
Thanks. Commissioner Miller, Candace Miller, sent me an invite, and I don't know if all of you got it or not, but for all of the members of the Board of Commissioners to participate in a tour of the Public Works facility and work being done on some of the county drains, thanks to the support of the board. They were looking for dates and times in the first 2 weeks of May. They want us to come on over. It'd take like a half a day. They're going to get a bus and kind of do a little quick tour of some of the properties and things that they're working on. They wanted me to get a few potential. So first I'd like to ask, the first 2 weeks of May, the first week we don't have any meetings. The second week, we have meetings. Would we, wish to, anybody that wishes to do this, we want to do it on a day we had a meeting and then just come in the morning, do the tour, have lunch, and then we have our meeting, or on a day that we don't have a meeting. So I guess I could take an informal poll of this, but meeting day, I got a lot of meeting day head shakes. But that would kind of take, if you want to come. So it looks like a meeting day would be it. And we have a Monday, Wednesday, or Thursday on the second week of May. Is any of those days, May 9th is a Wednesday, is May 9th work for everybody, or anybody who might be interested in doing something like this?
I'm wondering, depending on how many of us have to attend drain board anyway, which would put us there.
Which day is that?
That's on the 14th, and we've also got a meeting that day.
That's the third week. So they specifically asked for the first 2 weeks in May. I don't know why, but that takes us to technically the third week, even though Monday's still April. So does the 9th in general work, and then we can just kind of get a count of how many people would be interested? Okay. Good, thanks. I think that's a nice thing. It's nice that she's asked us to do it and realizes that the board supports her on all this stuff, and she's doing a lot of nice things over there, so.
All right, sounds great.
All right, thanks.
Commissioner Myjack.
Thank you. Just new business. We had a couple of drain board meetings this morning. Just some things I wanted to let you know about. So Hawkins Drain, which is in Sterling Heights, the county public works owns a certain amount of land. We're in the process of selling that for about $250,000. That will go back into that drain fund and or used in the drains in the Sterling Heights area. Second thing is the Public Works is also looking at selling a piece of property off of Hayes Road, which right now is used as a staging ground for the second road construction of M59. Right. And that property is going to generate a lot of interest. And Public Works Commissioner Miller mentioned, a starting price of about $4 million, okay, and up from that. And then once that's complete, that money will go back into the mid district because that falls in the mid. So just want to let you know of those two developments, and have a good day.
All right, thank you very much. Any other comments or questions? Any new business from staff? Seeing and hearing none. 10, public participation. Anybody in the audience wishing to speak? Going once, twice, thrice, we're done. Motion to adjourn. Drolette, support by Leonetti. All in favor, please vote. Thank you very much, and thank you for getting through the first meeting of the year without killing each other.